On the previous visits, Heart Attack Risk Assessment 1 and 2, I talked about how to determine if you're at high risk of heart attack or heart attack death. If you answered no to all the high risk questions in the Heart Attack Risk Assessment 1 visit, and your Framingham risk score was 20% or less when you filled out the Framingham Risk Calculator in the Heart Attack Risk Assessment Visit 2, then you're at intermediate or low risk. But even if your Framingham risk score showed low risk, you're actually at intermediate risk if you smoke, if you have a poor diet, or if you're physically inactive. You're also at intermediate risk if you have obesity or high blood pressure or high cholesterol. You're also at intermediate risk if you have a family history of premature cardiovascular disease. This means that if you have a father or brother who had heart disease before the age of 55 years old, then you're at intermediate risk. If you have a mother or sister who had heart disease before the age of 65, you're also at intermediate risk. You're at low risk if you have a Framingham risk score of less than 10% and you answered no to the 10 questions in the Heart Attack Risk Assessment 1 visit, and you have none of the intermediate risk factors that we just went over, and if you practice the healthy living habits. But low risk doesn't mean no risk. Now that you've determined your heart attack risk level, it's time to lower that risk. In the next series of visits, the heart attack prevention visits, I'll go over the things you can do to lower your risk of heart attack. And the same things that lower your risk of heart attack also lower your risk of stroke. That's it for now. Thanks for visiting. I hope you found this useful.